When you breathe, air travels through your nose, down the throat, through the windpipe, and into your lungs. The narrowest part of that pathway is in the back of your throat. When you're awake, muscles keep that pathway relatively wide open. But when you sleep, those muscles relax, allowing the opening to narrow. The air passing through this narrowed opening may cause the soft palate to vibrate. This causes snoring. In some people, the throat closes so much that enough air can't get through to the lungs. When this happens, the brain sends an alarm to open the airway. Most often this is associated with a brief arousal from sleep. The brain quickly reactivates the muscles that hold the throat open. Air gets through again, and the brain goes back to sleep. This disorder is called obstructive sleep apnea. Procedures to stiffen or shorten the soft palate can improve snoring. Procedures that open the airway in the back of the throat can improve sleep apnea.
Sleep apnea is a condition where, while you're sleeping, you literally stop breathing because you obstruct in your throat. You would think that not breathing is bad. Some people might think, I could die from this, and sometimes people do because you have a heart attack. As the pauses get longer and longer, that's what leads to the low oxygen levels that really damages and stresses the heart and the brain. There's probably 1,001 different conditions that can result from untreated sleep apnea. The more common symptoms are being tired all the time, no matter how long you sleep, waking up groggy, foggy-headed, slowly gaining weight. You can also be depressed. Many people who are on antidepressants or anti-anxiety medications actually have untreated sleep apnea. And same thing with people with hypothyroidism. Any of the chronic medical conditions like diabetes, high blood pressure, heart disease, urinary incontinence, going to the bathroom a lot, then you have to make sure you don't have sleep apnea. You have to get tested. If you have sleep apnea, overall, you have a 45% increased chance of dying for any reason. So just in 10 years, 45% more chance that you'll be dead than if you didn't have sleep apnea. Sleep apnea is a relatively treatable condition. It's not curable, but it's treatable. And we have very good ways of treating it. The first line treatment is CPAP, which is a mask that you put on your nose at night. It blows some positive air pressure through your nose and keeps your airways open so you don't stop breathing. Other options include dental devices and surgery.